Many public health educators said that their students and the public in general were interested in the microbiome, but they were mostly getting their education through marketing of probiotic products. So we decided to try and fill that gap with some modules on breastfeeding, antibiotics, and diet. The curriculum is designed to be modular so that it can be infused throughout the public health curriculum so that microbiome isn't seen as a separate subject, but really seen as a mechanistic pathway for understanding all aspects of public health, from chronic disease to infectious disease to maternal child health to policy.
It's been known for a long time that breastfeeding is good for babies, and this in a way is a public health issue. But despite that, and despite a lot of evidence actually that backs that up, there are still a lot of doctors and nurses, other healthcare providers, public health professionals that are a bit skeptical on how important this really is. And what I've learned from talking to maybe those skeptics is that when they see the data linking breastfeeding to the microbiome, they all of a sudden are sort of tipped in favor, and they go, okay, this is tangible, this is objective, I can see breastfeeding changes the microbiome. Whereas it's harder to see that, oh, breastfed babies are healthier 20 years later when they're adults. So for me, this is an opportunity to show through an objective, tangible measure of the microbiome that breastfeeding makes a difference.
The nutrition module in the health curriculum for the HMB program tries to explore the effect that diet has on our health. And usually we think about eating healthy from a long-standing literature that tells us about how, for example, a Mediterranean diet or cultural diets tend to be healthy for us. But we want to understand why that happens. And so through this module, we really understand the connections of how a specific diet can be healthy through the work of microbes.
We think about antibiotics as being miraculous, and in fact they are a small percentage of the time. For people who are really sick, there's nothing better than antibiotics. But most of the use of antibiotics are for people who have very minor illnesses, or illnesses in which antibiotics don't make much of a difference. So we're vastly overusing antibiotics. And people have known that for a long time. But what we didn't know is that there's a cost to that overuse. And the cost, in part, is what those antibiotics are doing to our microbiome.
When antibiotics kill the residential bacteria in our body, it can have perhaps surprising effects. For example, effects on obesity, effects on digestion of food. It can have like follow-up effects on other diseases that can come up.
The work of HMB can shape public health in Canada and around the world by broadening our perspectives on microbes, moving beyond thinking of microbes just as pathogens and thinking of them as beneficial, cooperative organisms that we rely on for our health, and also even challenging the idea of infectious disease versus chronic disease. We think they have a shared microbial pathway, and so really expanding our views of public health. We think that the Humans in the Microbiome public health curriculum will help people think more microbially when they're making decisions about their personal health or population level health, and trying to understand how their behaviors and their attitudes towards microbes impact their decisions all the way from personal decisions to policy.